As we approach the summer months, we're still seeing many, kids included, becoming sick. And if folks are not testing for COVID, it may be going undetected. Eric, how are we seeing the consequences of these potential cases going up in our data?
Yeah, the numbers are still quite stark if you actually dig into it. And by stark, I think the starkest numbers that we've seen is that life expectancy has dropped for 2 consecutive years in a row. And the life expectancy drop is humongous. It's over like 3 years in terms of expectancy drop. And we haven't seen 2 years of consecutive life expectancy drop in the United States or worldwide for the most part in over 100 years. In the United States, definitely over 100 years. And the gains that we've lost over a decade or more in terms of in these gains. But sometimes people just think, oh, deaths. Yes, we know people died, but I think people need to know that life expectancy drops are driven most by young people, young adults, children dying, not just the elderly. Because when someone who's elderly dies, it doesn't budge the life expectancy that much because they're already oftentimes near the end of life. But the sharp drop in these statistics means that, for example, if someone in their 50s or 40s dies, that you're losing 30 to 40 years of life. And if someone who's young in the 20s dies, they're losing 70 years of life. And someone who's a young child life, you're losing 80 years of life. And that is what pulls the numbers down. And the numbers clearly show that COVID was a leading cause of death. And more importantly, for all to debunk a lot of the disinformation out there, COVID was a leading cause of death in children. We're talking about infants, toddlers, school children, teenagers. It was a top cause of death that ranked in the top 10. Um, and I think that is what has not been appreciated whatsoever. And in the coming years, the excess deaths due to COVID are still going to continue to accrue. We're seeing not only many other infections, but the long-term morbidity on the healthcare system, the strain, the cost, is still going to compound. And we see it in many other countries like the UK as well, where their health system is completely overwhelmed. But in the meantime, the life expectancy numbers don't lie. These are humongous, record-setting life expectancy drops from the mortality. So it's not just small differences. And even in the best of countries, they no longer gain life expectancy, um, but instead they had flat life expectancy whenever their country should have been gaining life expectancy. So even in the wealthiest countries, we saw this huge either drop or flattening. In other countries, it was, of course, much worse. But that's the stark reality. And I think we have to remember that kids may be, lower risk of dying than the elderly, but kids shouldn't die. Young adults and kids shouldn't die, period. Like zero kids should die. And also that 70% of all infections in households were seeded from children, according to a latest study. And I think that's why together we must protect everyone, not just have focused protection on just an elderly or immunocompromised group. It still requires a population level approach to stop infection, stops deaths, and morbidity for years to come. And I think that is what we have to appreciate about this ongoing pandemic.
All right. Thank you so much, Eric, for joining us today. For more information, please go to WHN.global. You can join our community and sign up there. Have a great day.